Assalamualaikum Doktor. First started, can you introduce yourself and your academic background?
Okay. Waalaikumsalam. Welcome to my clinic, Dentist Malaya. Hi, my name is Dr. Muhammad Furqan Abdul Rahim. I was graduated in 2014 in Jordan University of Science and Technology in Bachelor of Dental Surgery, BDS. So I took my doctorate in dentistry in Jordan 10 years back. Since then, I was working with the government clinics and hospitals until 2019.
The first question that we would like to ask is, can you tell us about the background of your clinic?
Actually, it's began in 2018. My first clinic. Now, I have 5 branches of my clinic with the brand name of Dentist Malaya. This is the first branch of my brand in Sentul Perdana. Back in 2019, I opened this clinic with a few of my partners, with another 2 doctors, and our mission and our aim is to fill the gap between affordable dentistry and innovation in dentistry. So we want to mix and match between affordable price and the innovation.
Interesting. The second question we would like to ask, for how long have you been working in this industry?
I've been working for 10 years, more than 8 years in government sectors.
Why did you choose to be dentist and what inspired you to open a dental clinic?
After SPM in 2009, the number of dentists in Malaysia is very small numbers. It's very lacking in this specialty, and this profession is very low in numbers. So the demand is growing back then. I saw that there is opportunity in this field, that I can make more improvement and I can make more contribution to the field. And I feel like I want to explore the field of dentistry since it is in healthcare branch. So I want to make innovations, and I want to try to improve the healthcare involvement in this country.
Drop it.
Alright, Dr. Furqan. So, based from our research, we have found an article that stated in Malaysia, 94% of Malaysian adults suffer from gum problems and 71% of them suffer from tooth sensitivity, and nearly 46% of them experience yellowing of the teeth. So, my question is, how often should this patient, especially adult patients, should visit the dentist for routine checkups and cleanings?
Great question. In Malaysia, there is more than 90% of Malaysian that having gum problem. We call it either gingivitis or periodontitis. The disease is that because of lacking of oral hygiene or oral care. It is recommended to visit the dentist twice a year, 6 monthly. Every 6 months, need to visit the dentist to check or do any routine cleaning or just dental checkup to know how the progress of disease, or if there is any progression of gum disease for everyone oral health, and to make sure that everybody know that how to do the oral hygiene care with proper knowledge.
So, what are the essential daily oral hygiene practices that you could recommend for maintaining healthy teeth and gums?
Besides doing normal routine of teeth brushing, now it is recommended to use floss, to do flossing every day, at least once each day, every day. And now, besides do routine checkup 6 monthly, visit the dentist, it is better to use oral care mouthwash. Like there is a lot of brand in the market, especially in the pharmacy. Now it is very accessible to use mouthwash such as Listerine, Sensodyne mouthwash, or any. Besides that, there is a lot of oral hygiene recommendation. Like now, even toothpaste, we have very advanced and very niche to the disease, what disease that the patient have, and it is to be used every day, especially for gum problems. Since we are saying we are discussing about the gum and sensitivity. There are a lot of incoming brands that are good to be used for each patient, especially in the issue of dental hygiene and also the disease, to combat the disease.
I see. So what are the most common dental issues that you have encountered during your practice, and what preventative measures do you advise to avoid?
Preventative measures for gum problems, for gingivitis, for everyone to know the proper knowledge of oral hygiene, to know it from online, from magazines, and to master how to use toothbrush, oral hygiene care, mouthwash, like we mentioned before, and each time the patient go to the dentist visit, to prevent the progression of the disease or to prevent the disease to being occurred, it is better for the patient to make consultations, to make proper consultation with the dentist, and to know and notify what is the disease and what is the exact problem of our own oral condition. So that everyone need to know what is the problem of their oral care, and when they know exactly what is the specific disease that they have, they know how to combat it and consult with the dentist, and make sure to take note what is the recommendation by the dentist and make the proper way of how to combat it and prevent it at home.
I see, very interesting. We also did some studies, and we found an article that says about 94% of Malaysian adults suffer from unhealthy gums, and this issue is more prevalent among adults around age 35 to 44 years old. So what early signs of dental problems such as cavity or gum disease should patients be aware of?
For gum disease, the first symptom is bleeding gums. When someone found that every time after brushing teeth, he or she find there is bleeding from their saliva, or when he or she gargle, and then see the stain on the water after gargle, and then she needs to go to the dentist, and because that is the first sign of gum problem or gingivitis. So the most common symptom is the gum bleeding gums, and that is for the gum problem. But for the teeth caries, the most common is the sensitivity on the teeth. So when someone drink on cold water or hot water, if he or she find that it's very sensitive, whenever a drink on hot or cold water, then need to seek treatment to do the further action.
Doctor, as we know, fluoride plays a big role in dental care. Why is it important, and how can patients ensure they receive enough?
For public health perspective, fluoride is being used inside the water. Even in our pipe water, tap water, or even in our drinking water, there is fluoride. There is recommendation from the Ministry of Health on how many percentage of fluoride inside our water dam, so that everyone will be distributed fluoride with safe amount inside the water. So from this, we know that fluoride is very vital in the prevention of caries or cavity of the teeth. So to prevent the caries of being happen, there is the need of fluoride inside the water. And besides our water, drinking water and tap water, fluoride is being used inside every toothpaste. So I'm not saying that a large amount of fluoride will help, but it is optimal amount of fluoride that will help to combat the caries or cavity, dental cavity. If there is too much amount of fluoride, there will be another problem. We call it dental fluorosis, which will cause the teeth to become flaky and there is white spots on the tooth. So the amount of fluoride is very crucial, and we cannot deny that fluoride is very vital for prevention of cavity.
Based on the article from World Health Organization that we did a research on, we found that inadequate exposure to fluoride in toothpaste is one of the reasons for oral diseases. Which affordable toothpaste would you recommend for people to use?
From the market, the toothpaste price is not it's not different in between the brands. So let's say there is Colgate, there is Sensodyne, now we have Darlie, Fresh and White. So most of the content ingredients of each toothpaste is similar. So for me, as long as there is good percentage of fluoride inside the toothpaste, then it is suitable for everyone to be used. But for children, the amount of fluoride must be different than the adult, because growing teeth below for children below 8 years old, it is recommended that the fluoride percentage is lower than the adult. So that's why we have special toothpaste for the children. In terms of affordability, any brand actually has the same formula, same ingredients inside it. Besides the fluoride, there is additional of preservative of xylitol and so on. So actually, in Malaysia, normally we use Colgate, but other brand like Fresh and White, Darlie also is recommended.
I see. How does diet affect oral health, and what foods or drinks should be limited to avoid dental illness?
Food intake is very crucial for oral health, and in Malaysia we have most of our food is containing a lot of sugary, and it is in the sugary diet segment. Diet that we need to avoid first for dental, especially for dental health, for oral health. The first one is the high sugar foods, high carbohydrate foods, because from carbohydrates and sugar, the cavity and the caries, it can be extended. So it can be extended inside our teeth. So we need to reduce it. And each time when we consume any high sugar intake of water or food, we need to make sure to rinse our mouth, and also we make toothbrush every time we consume the food or drinks. And we need to avoid gassy drinks, especially with high sugar what we call high sugar ingredients inside the canned drinks like Coca-Cola or Pepsi, because the gassy drinks will increase the acidity, and it will cause attrition inside our oral hygiene. So our tooth surface, it can be attrited because of the gassy drinks and liquids.
I see. What recent advancement in dental treatments and technologies have you integrated into your practice to enhance patient care?
In my clinic, innovation and up-to-date technology is our priority. We use the latest technology to solve our patients' problem, especially in orthodontics. We do teeth aligning. Besides, we use the normal braces, traditional braces using metal wire. We have our own brand of clear aligners, and clear aligners is very recent technology that not every clinic has it. And we also invest in laser treatment, and our doctors, all of our doctors is laser trained doctors. So this is to make our patient have affordable treatment with proper care and advanced care of technology.
Okay. What problems arise from misaligned teeth in adults, and what orthodontic solutions are available?
From misalignment of teeth, besides aesthetic problem, because most of people, we just focus on the cosmetic issue. Actually, it is more than that. Orthodontics can cause a jaw problem. We call it TMJ problem. The joint in between the jaw. Whenever the teeth is misaligned, someone will have problem when he or she want to chew on food. So this make them very difficult to eat every day or after sleep. There is grinding, and we call it bruxism, which causes very fatigue, and the joint and muscles of the face will be very stressful. Besides that, the misalignment can cause gum problem to be worsening. When the food stuck in between the crowding teeth, the gums will be inflamed, and the bleedings of gum will be very worsening, and the condition of the gum is very difficult to be to have the proper oral care, because whenever you do toothbrushing, there are areas of the gums that cannot be covered because of the crowding of the misalignment of the teeth. So that's why we need to solve the misalignment problem. Like I mentioned before, besides the braces, the normal traditional one, the normal fixed braces, now we have clear aligners and we have a lot of other treatment. We have direct aligners, we have active retainers, and that depends on the condition of the patient. And our clinic is the leading in this area of specialty in this country.
Speaking of braces and aligners that you mentioned earlier, what care routine that you can provide for people that are wearing braces and aligners also?
Why most people choose clear aligners? Because it is easier for them to make sure the care of their oral hygiene. Because clear aligner, it is not fixed on the tooth, and we can remove it whenever want to eat or whenever want to brush your teeth. But for braces, traditional braces, our patient, we always recommend our patient to use advanced care of dental care. Besides using the normal, the very soft, ultra soft toothbrush, they need to use, we call it super floss, so that in between the teeth, it is clean. And besides that, they need to use the mouthwash. Normally we recommend a special one to avoid the sensitivity and also to avoid the gum to keep bleeding and inflamed. For clear aligners, each time to take the aligner out from the patient's mouth, they need to make sure it's clean. Make sure to run the tray of the aligners on the tap water, and each time we will give a special case of aligners to be put whenever the patient doesn't wear it. And after that, they need to make sure their oral hygiene continuously good, and also besides their oral hygiene is good, their aligners hygiene is also good.
Why do you think there are reasons why some people are reluctant to get their teeth checked?
Most of people reluctant to get their teeth checked because they have fear of dentists. Or there are two things why they don't want to see dentists, or they don't want to do the dental checkup. One is because the fear of dentists. The second one is the cost of seeing dentists. The first one is because of fear. That's why the initiative from the government during the school times, there are dental visits from nurses or dentists to the schools, and that's why we educate the children, the school children, to be familiar with the dental treatment and checkup. This is because we don't want people to be afraid to the dentist, because when someone thinking of dental clinics or dentists, they will think about the injection and so on. So we need to explain, we need to educate them on the importance of dental treatment, the importance of dental checkup. And the second one is the affordability. Some people, they cannot afford to cover the cost of dental checkup. In government, we have a government clinic that do dental treatment nearly for free. So most of people, they can seek dental checkup for free at any of the government clinics. And now in private clinic also, we offer, most of private clinic also now offer free or very low cost dental checkup.
Who do you think play an important role in our society in raising awareness about dental wellness?
The most important is the educator, the lecturers or the school teachers or the kindergarten teachers, because from the educator, everyone will get the education of importance of the dental and oral hygiene. Yeah, for me personally, I think the educator. So who will educate? The educators, the dentists and the dental nurses.
The last question that we would like to ask, what is your advice to the adult about dental wellness?
My advice is to do the routine dental checkup 6 monthly. So every 6 months, need to seek for oral hygiene or oral care checkup. And my second advice is to train ourselves to become disciplined to do the oral hygiene care routine, such as twice or 3 times daily teeth brushing, using mouthwash especially for those who has gum problem, and to do dental flossing every day.
Thank you so much for sharing your knowledge and experience with us today. It was enlightening to learn about dental wellness. Your insight have made a real difference here. Thank you, Doctor, for your advice.
Thank you, Doctor.
Okay, you are most welcome.
soon.